You're watching the Fox 5 Morning News.
All right, good morning. If you're like many Americans and you are just fed up with the high prices of prescription drugs, there's actually a reason behind it.
We don't need to tell you, prescription drugs here in the U.S. cost more than literally everywhere else in the world. And here's just one example that we have for you. Ready for this? The cancer treatment Gleevec costs more than $6,000 a month in the U.S. In comparison, in England, it's $2,600. In Canada, it's $1,100.
So Dr. Richard Shafu is here with us this morning. Doctor, this affects my dad's a type 2 diabetic, and I see him struggle every single month with getting drugs and looking at the bills every month. Why is it so expensive?
Well, Shelly, that's a great question. There are a number of reasons why drugs have become so expensive. You know, in a lot of countries where they have a national health insurance plan, the government will buy that medication for the entire country. And so they're able to control costs, as you said earlier on, in Canada and also in the United Kingdom. In the United States here, unfortunately, that's not the case. Drugs are actually bought by insurance companies, by hospitals, by other healthcare organizations, and then they're distributed to their consumers.
The research and development, companies always point at that because it takes them a long time. They have to get through so many trials, and it costs literally into the billions of dollars to get a drug onto the market. How does that process work?
That is correct. Drugs are very expensive, and they're getting more expensive to make. The problem is that it may be, as you said, $1 to $2 billion, but it may be a whole group of drugs, Raul, that they're researching and developing, whereas only one of those drugs ultimately makes it to market.
Okay, I want to talk, I know that this affects a lot of people, but this came back into the headlines. I think it was last week that we saw a price of a drug literally, like, I'm not even saying flipping, like it just went out of control.
That guy. Who became the most hated man on the internet in the world. So
that drug, and you probably, our friends at home, you probably remember hearing about Daraprim. Is that what it's called? Yes. What was that drug? And then we're going to talk about what happened with the price of it. What is that drug, Daraprim?
So Daraprim is used as a drug for treating infections, opportunistic infections, like opportunistic from things like toxoplasmosis and other infections, AIDS-related malarial medications. So it's a drug that's not used massively like a penicillin drug, so it's on a smaller scale, so fewer people are actually
But those people need it.
But they definitely need them,
so it was
$13.50.
So did it change? Is that what it changed to, we're guessing now?
Correct.
Literally overnight. And folks, you probably know, if you know the story from last week, it literally changed overnight.
For one?
To that. Correct. How is that allowed? People are worried about government intervention, but how does that happen?
Exactly. Well, I think the problem is that there aren't controls over the cost of medications. As you said earlier on, there's no governmental regulations, and Congress obviously needs to look into that as a problem.
Wow.
Okay, let's move to the next drug. What is this? What is it called? What is it for?
So cycloserine is a coxarin, which is a medication that's used for cancer treatment.
Okay.
Again, not for large quantities of people, but relatively restricted.
Okay, and then so how much, right now it says $500 somebody would be doing this for a month?
Correct.
You want me to guess?
I want you to guess.
1,000?
Let's have a look.
There we go. Oh, come on.
Please tell me you're joking.
That's almost $11,000 a month.
So clearly we need to do something as a society. All the organized medical organizations are really up in arms about this.
Is this price what people are paying out of pocket, or this is what goes through insurance and insurance is covering
So
some
Shelly,
of this?
a lot of this will go through the insurance carriers, but remember, as we know now, the cost for health care has gone up.
Yes,
so
somebody has to pay for that.
So someone's paying for that, correct.
The last example we have here is doxycycline. It was $20 a bottle. $20 a bottle.
What is doxycycline?
So doxycycline, Shelly, is an antibiotic. It's been around for many, many years. It's
a
form of tetracycline.
Okay.
Exactly. So it's for acne, for other infections.
Highly used? People use it a lot?
Very often used.
Okay, very often used. Okay, so it was $20 a bottle. You want to guess?
I'm scared to even take 2,000. The amounts are ridiculous.
Okay.
Here we go. Oh my goodness,
I
was close.
Very
that's
close.
shocking.
So that brings up an important point. Instead of these newer drugs for smaller groups of people, these are generic drugs that have been around for a long time. So why are they so expensive? Part of it is because these are not made very much by many companies anymore because the profit margins are relatively small. They're made in companies overseas, like in India, they'll make these. But the problem is that a lot of these factories have had problems in terms of quality control, active ingredients not being very well monitored, and so a lot of them have shut down, and so the supply is not available. Plus, these are not particularly profitable or haven't been for companies, and so there are fewer of them making it, so they have essentially a monopoly over the cost of these medications.
Do you buy the excuse, especially for the Daraprim guy, where he said, look, I need to raise the price because we need to further develop newer drugs, better drugs? Is that legitimate?
No,
or
it's
is that
not a legitimate argument. It doesn't hold any water, and I think medical organizations as a whole, physicians or patient advocates, are outraged at some
as
of these
bad as
price
this
increases.
is, when you see this one, this is even worse.
This is even worse.
And nobody's talking about that one. It's because this guy had pictures on Facebook where he's acting like a buffoon.
Exactly.
Yeah.
This guy, unbelievable.
Dr. Shafu, before you go, because I know that there are a lot of people at home that struggle with this. You got elderly, you got young, you got everybody that, unfortunately, that we rely on drugs so much nowadays. Is there anything anybody can do instead of just looking at their bills and feeling like, how am I going to pay for all this stuff? Anything people can do at home at all?
Well, I think the important thing is to do your research, go to your physician, find out, is there another drug that can be used that's not a brand name, that's a generic? But as we've shown on the program, some of these medications are very specific, and now there are medications that are made by biological means, in other words, by cells that are being developed as new treatments that are even more expensive to develop because the research and development requires much more stringent regulations.
Wow, this has been enlightening. Dr. Tafu, we thank you, of course, for your expertise in this.
Raul.
And I mean, we've heard it during presidential debates in the past, a lot of politicians talking about this, and then it kind of ebbs and tides, and then it just kind of goes away.
Yeah.
The conversation needs to come back to the forefront.
I have a question, you
Chrissy
guys.
has a question.
Yeah.
May I ask the doctor, what do people do who don't have insurance, who have health problems? You know, I mean, you go to the pharmacist, you get your prescription, and it's $2,000. You don't have, who has $2,000? Who has $1,000? What do? They just don't get the medicine?
Well, that's a great question because you're right. Some people will decide whether they can actually eat or take a medication, and that shouldn't be the situation.
But this
that we deal
isn't
with
eating
today.
or taking medication. This is like more than your mortgage and your rent and your car payment and all of that. Like, this is not achievable for anyone. Like,
Correct.
who could pay this? This is like, I mean, what do they do? Do they negotiate with the pharmacies, or how do they get their medicine?
Well, I think the important thing is to find out what health plan that you're on, to do research, and as a consumer look at that. Obviously, you know, writing to, there are insurance company commissions that people can make formal complaints to. Again, you know, who do we decide to be our leaders in Congress?
Correct.
Because these are all very important, pressing issues. We can't help getting cancer or other serious diseases like diabetes.
Right.
And so the public should not be manipulated to a point where they're having to choose between their health and being ill based upon the price of a drug or a medication. It really is outlandish.
I'm still blown away by this. Dr. Chafu, thank you. Wow.
Thank you.
All right.
It's not even possible.
Yeah.
I mean, it's not even like, oh, am I going to eat or am I going to get this medicine? It's like, I'm not going to do anything. I'm not getting the medicine. All right, guys. Thank you, guys, by the way.